What is diabetes? Diabetes is a chronic, long-term medical condition that affects how the body converts food into energy. Our bodies break down most of the food we eat into sugar, glucose, and release it into the bloodstream. When blood sugar rises, it signals the pancreas to release insulin. Insulin acts as the key to taking blood sugar into the body's cells to use it as energy. When you have diabetes, your body cannot make enough insulin or use it as needed. When you don't have enough insulin or your cells become unresponsive to insulin, excess blood sugar remains in your bloodstream. Over time, this can lead to serious health problems such as heart disease, vision loss, and kidney disease. There is no cure for diabetes yet, but weight loss, healthy eating and exercise can really help. Other things you can do to help: take prescribed medicines. Get diabetes self-management training and support. Make and keep doctor appointments. Types of diabetes. There are 3 main types of diabetes: type 1, type 2 and gestational diabetes, diabetes during pregnancy. Type 1 diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction, where the body mistakenly attacks itself. This response prevents the body from producing insulin. About 5 to 10% of diabetics have type 1 diabetes. Symptoms of type 1 diabetes often progress rapidly. It is usually diagnosed in children, adolescents, and young adults. People with type 1 diabetes need to take insulin daily to survive. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes. In type 2 diabetes, the body cannot use insulin well to keep blood sugar levels at normal levels. About 90 to 95% of diabetics are type 2. It develops over many years and is most commonly diagnosed in adults, but is becoming more common in children, adolescents, and young adults. It is important to test blood sugar levels in some cases. Type 2 diabetes can be prevented or delayed by making healthy lifestyle choices such as lose weight, eat healthy foods, be active. Gestational diabetes. Gestational diabetes occurs in pregnant women who have never had diabetes. Gestational diabetes can put your baby at an increased risk of health problems. Gestational diabetes usually goes away after the baby is born. However, later in life she is at increased risk of developing type 2 diabetes. Babies are more likely to become obese as children or teenagers and later develop type 2 diabetes. Pre-diabetes. In the United States, 96 million adults, more than 1 in 3, have pre-diabetes. More than 8 out of 10 people don't know they are infected. In pre-diabetes, blood sugar levels are higher than normal, but not high enough to make a diagnosis of type 2 diabetes. Pre-diabetes increases the risk of type 2 diabetes, heart disease and stroke. But there is good news. If you have pre-diabetes, a CDC-approved lifestyle modification program can help you take healthy steps to improve your diabetes.